Two, one. I think we're live. Hey, Natasha, how are you?
Wonderful. I'm doing wonderful. Thank you for having me here.
No, it's my pleasure. I think the guys who are clearly interested in everyone's interested in Max Fax. It's one of those super interesting topics. Really interesting career path as well, because it's a very wide-ranging thing. So, I'm
I'm doing wonderful. Thank you for having me here. I
I'm
was like, looking back. Sorry, give me one. Okay, I had the YouTube open on my laptop. Sorry about that.
no worries.
Okay, I'm back.
Yes, I think we're very excited to hear from you and see what you have to say. How's your week been?
My week has been wonderful. So about 4 months ago, I started the second year of my residency, and as soon as I started it, I realized that there were new expectations, new things to learn. So for the first 3 months, I was of those 4 months that I was going to rotate at the hospital that I'm at, I was super stressed out. This month, things started to finally kick in, and things were starting to make sense. I felt like I've made progress like clinically and didactically, so I finally started to relax. But the last 3 months were very stressful. So July to September.
What was it so what made it so stressful?
So the hospital that I was rotating at, or that I am rotating at, we were seeing more complex, consults in the ED, more complex lacerations, more complex infections, and that was something that coming into this year I hadn't seen as much of
Right.
just yet. So just managing that was, took a little bit of learning. The cases also that we were doing at the hospital that I'm at, they were more complicated, whether it was the dental alveolar stuff or whether it was the OR things, everything was just a bit more complicated. So just learning a whole bunch of new things. And I'm the type of person where if I have 4 months to learn something, and I'm grateful for this, I tend to stress about it, learn it in the first 3 months, and then I relax. That's just how I usually function. So this month I've been a bit happier.
Yeah, and how were you affected? Because I know before we went live, we were talking a little bit. How were you affected by the COVID situation? Did your program kind of pause, or did you carry on working throughout?
So they shut down elective surgeries in New York State, whether it was head and neck cancer surgeries, any elective dental alveolar, cosmetics, implants, everything. They shut all of that down. The only things that we were, treating were trauma cases that were coming through the emergency department or infections that needed to go to the operating room. So just to manage that volume of cases, they did not require all the residents of the program.
Okay, fair enough.
So a bunch of us went to either the medicine floors or the ICU. I went to the ICU to help out over there, and they also needed help at that time. They needed more bodies in the ICU. I think they expanded the ICU capacity by about 3 times the amount at my hospital. So I spent a bit of time in the ICU. And by the time that time ended, New York kind of started to pick back up again in terms of doing cases and elective surgery. So then I went back to service, but I was in the ICU for about 6 weeks or so.
And how was that experience within the ICU? Did they have you doing what kind of jobs were they having you doing really?
Um, they were having me carry patients. So, the first week that I was there, every little thing that I had to do, every order that I had to put in, the blood draw that I had to do, I was asking for help on it, or getting tips from other medicine doctors who I was in the ICU with. But then as time went along, I became a lot more comfortable. But I was carrying my own patients. They were good in the fact that they would not have me carry more than, so if a medicine resident was carrying 5 patients, I would carry maybe two or
Yeah,
three. They tried to give me the patients who were not,
too severe.
yeah, exactly, who were not, who didn't need acute things taken care of for them, who were kind of as stable as you can be while you have
Mm.
COVID, uh, and are in the ICU intubated. But that's kind of the patients that they tried to give me. But they also tried to lighten the load and to balance things out. They did give me patients who also needed something done for them. So it was a mixture. It was really sad to go through that whole thing. I think I had to inform one set of brothers that both their mother and father passed away in our ICU. I informed another father that he lost his son and he lost his sister while they were, in the ICU. So those kind of things were not, it was definitely not fun, but it felt good that I was helping out, that I was able to contribute in some way.
Yeah.
That
No, I think it's a situation which I think nobody wants to have to go through. We hope we never get to that kind of a stage again, because the majority of these cases, if we have good social etiquette, almost we can avoid part of it. So hopefully you won't have to be ending up back in there anytime soon.
I hope so. I mean, I've been a little bit nervous as I've been looking at the numbers again, and they are creeping back up in New York State. Like I was saying, not so much in Manhattan just yet, but definitely in New York State. So it's a bit
Yeah.
worrying, and we'll see what happens.
And then once you got past that stage and the cases start dropping, what happened with your program?
So we opened back up right away. There was no stipulations on what we could or could not do. We were doing our sedations the way we normally do. So the hospital that I'm at, it has its own little surgical suite within the OMFS dental clinic itself. It's this huge room with all of the monitors. We have a dental anesthesiologist with us, so if God forbid a patient needs to be intubated or they need to be really really sedated, we can definitely manage all of that. So we were able to jump right back into just doing what we would do even before COVID hit. Of course, what made it a little bit easier at the hospital that I'm at is that they have a huge waiting room.
Yeah.
So the hospital doesn't have to say that you need to see lesser number of patients because you cannot have so many family members or so many patients in the waiting room. They also have a huge garden slash backyard that's affiliated with the clinic. So we often have like patients wait out there while they're waiting to get registered or waiting to get seen. The rooms are huge. The clinic is huge. So all of that played, it played a positive
It's
role
favorable. Yeah,
on
you've got a
people.
favorable environment, haven't you, there?
But I don't think every hospital had that
No, I
situation.
think you I
Every
think you kind of get lucky in that regards for sure. Um, how do you see your program going? Have you enjoyed it? Let's just ignore this whole craziness of 2020, right? How is the actual program been? Has it been exactly what you thought when you were applying, or has it been harder? Has it been easier than you thought?
I think I tell this to my co-residents often was the day I matched is the day I got more stressed out, even more stressed out. I was like, oh gosh, now I actually have to learn everything and know everything. Um, but has it been what I expected? That's I don't know if I really had any expectations coming in. I think I just knew that I really wanted to do OMFS. I really enjoyed it. And whether it was going to be the most challenging thing for me or not so challenging, one way or the other, I wanted to do it. So that was really all my thoughts coming into this whole
Yeah.
thing. I think the stress levels have been high and low, high and low. So, like I said, from July to September, I actually remember telling some of my co-residents this or sharing with them that I was, at a whole level of stressful than I've ever been. And then there's months like October where I'm a little bit more relaxed and I can go out and feel comfortable to enjoy my weekends and not feel like I have to study all the time or read all the time or stress all the time. So I think it has its ups and downs. There are some months that are a little bit worse and there are some months that are a little bit better.
Yeah, it's funny you say that, you had this kind of idea of it was okay, and then as soon as you got in, it was worse, because that's kind of what I'm worried about. I really want to do endo. Um really, 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 really looking forward to it, if I once I eventually kind of apply and get in, hopefully. But part of me just thinks, oh god, it's going to be a lot of work. Like, I'm going to have to do so much reading. And my friend, he's doing it at UF in Gainesville, and he's
Okay.
just got stacks of reading. He sent me some of the reading lists, and I'm going, oh, no, I don't want to do this now.
No, I didn't think of all that getting in. I think when I wanted to get in, I just thought of getting. And then what I'm gonna have to deal with once I actually get in hit me the day I matched.
Yeah, I think it's because I know someone, like a close friend of mine is actually doing it. I was thinking, oh, maybe it's not the best idea, because at the moment you just think, oh, you just want to be really good at endo. I want to really be really good at something. You don't think actually they're going to make you do loads of essays. They're going to make you do a dissertation. They're going to make you do reading, all of this, and they're going to make you pay for it all, of course, as well.
Yeah, no, It sounds like a lot.
But it'll probably be worth it in the end. It's just funny that you kind of had you kind of said something that I was thinking already about my own situation.
Yeah, but like I mean, I think there have been months where I've also not been as stressed out, and then there have been months where I've been. We have a month, we have a yearly exam that we have to take. All residents have to
Yeah.
take it. It's called the OMSITE, and before I got in, a couple of my co-residents were talking about how difficult it is and how completely random it is and how you cannot prepare for it and it's just not possible. And my chairman cares what you do on the exam. If you do well, more opportunity to you in residency. If you don't do well, he doesn't trust you as much, even though that exam has nothing to do with how good your clinical skills are or how much of actual OMFS you know. But because I heard all of this, probably 9 months before the exam were to occur, I started studying for it, stressing for it more than actually studying for it. Everybody in my life knew that I had this exam to write. Friends, not very good friends. So,
People on the bus, on the subway.
but then after I wrote the exam again, there was a little bit of a mental break.
Yeah, I think that's the thing. You know, it's probably something that was looming in the background, and it's just getting closer and closer. And then you think, oh, you just gotta, yeah, I can't do that. I've got a big exam coming up, and you just tell everyone. But I think it's fine. You know, you get through it at the end, don't you? I think that's the thing. Like, I was talking to my cousin last night actually, and he was going, "Bro, we got through dental school. You can do whatever now."
Sure. I actually, someone that I know on Instagram was just sharing with me how I hadn't heard from her in a long time, and I was like, hey, like I hope things are going well. She like recently posted, and I was like, hey, I hope dental school's going well, and she's like, it's so much. Like I can't believe how much we have to learn every single day, and I was like, yeah, I relate to that. I remember during our second year, we would hand in one project, and then there would be 5 more that would do within the next week. So,
Yeah.
yeah, it is a lot to learn in a short period of time. It doesn't seem like it might be, but it is.
Where did you go to dental school?
Canada.
Canada.
Canadian, yeah, I'm Canadian by background. And I moved to New York for residency, but I was in Canada before that, and Dubai before that.
Yeah, well, first tell me about dental school, and we'll talk about moving from Dubai to the West after as well.
Dental school. Dental school was, again, one of those things where I was not expecting it to be challenging. It was, I mean, I knew I wanted to get in, but that was, again, as far as the thought process went. It seems to be a recurrent theme in life.
Yeah.
But it was a lot to learn. It was, so I lived in Toronto, Canada, up and until dental school. And then for dental school, I moved to about a school that was 2 hours away, if I remember it correctly. And we had wonderful staff. Everyone was great. Professors, teachers, all great. Our clinical experience was really, really good too. I now hear about like the clinical experience of my core residents who graduated from dental schools in the States. And I'm like, we did so much more than you guys. And I always thought that because US has such a larger population, they have more clinical experience, but they don't. We actually, like, our program really made sure that we got a lot of things done. We learned a lot. It was a good experience. I did not know at that time that I wanted to do residency or OMFS. That was something I figured out later.
Yeah, I think it's almost on a case by case basis, isn't it, with dental schools? I see some dental schools where they're just doing loads of like they've had implant experience. They're doing all kinds of. Someone was doing an alveoplasty. I was like, I wish I'd done an alveoplasty in dental school.
Yeah, I saw it on Instagram.
You're probably
Yes.
the same person I'm following then, actually. And I was like,
Yes,
you're a dental student. You're a second year dental student, no less. And I think it was second year. I was like, we were barely using like impression material in second year, or second year of clinics anyway. It's like, God, that's just on a whole other level. So maybe it's like down to the individual's experience as well.
for sure. I actually, so I'm sure it's the same in the UK, but you can do a 1-year dental residency as well after dental school. It's a hospital-based residency. They call it a GPR over here, general practice residency. And so we tend to work with them at my hospital a lot. And one of them very casually the other day was like, yeah, I placed like 10 dental implants in dental school. I was like, I have not placed 10 dental implants. I'm in my second year of OMFS. I'm about to do it, but I have not.
I've I've not even watched an implant being placed.
Oh no.
That's yeah. There was
Okay.
like an opportunity during my training year after uni to see it, and either something went on and I had a patient come, in pain and I had to go deal with that or something, or I was off the day, or he rearranged or something. I can't remember exactly what happened, but I didn't end up seeing that implant being placed. So I've literally not even seen it. The closest I've got is YouTube videos, is talking to implantologists on Instagram Live, and them
Right.
showing me some cases. I've actually not seen any. It's crazy what kind of a big difference there is between everyone's experience. Not that it's good or bad. It's just it is what it is, isn't it?
I think there's things that they need to learn, or dentists need to learn coming out of dental school. For the most part, everyone learns it. But yeah, you're right. It's very individual based. I think some people really see lots and do lots, and then some don't end up doing so.
Yeah, weirdly, I had lots and lots of endo, so I don't know if that's kind of given me that's maybe pushed me down that particular road. But I'm happy with that. Like I enjoy it, so it is fine. Um,
How many years out are you? I actually don't know.
I qualified 2017, November 2017. Yeah, so pretty soon. Not soon. Pretty recent, yeah. And then I took 9 months of traveling, so I didn't really, I've not done lots.
No, very smart. That's very smart because once you like start a new residency or specialty training or you start working, I think it becomes so much harder to find time off. If you're, people you're working for want you there, they're not going to give you time off so
No.
easily. Or if you're in if you're in training, they're not going to give you time off that way too. So that was really smart.
Yeah, I don't know about smart, but it's just how things landed. Like the job that I was supposed to start, it didn't start till September, so I had from November till September to do whatever I wanted essentially, and I decided to travel. Incidentally, this is when I started Dents of Insta, so it's all around that time this all kicks off. Um, well, it's been a fun kind of situation. Incidentally, I went to Dubai during that time, so I actually have family out there, so I kind of know my way around a little bit, not very well, but a little bit. So, how was that when you were growing up over there?
So Dubai was not Dubai when I was growing up. It became what it is in the early 2000s or maybe a little bit before that. But when I was growing up, it was essentially a desert.
Hmm.
Um, Nobody knew what Dubai was. They never heard of it. It was more so that, folks from India and Pakistan, they knew that there was this city out there where it's tax free, there's lots of opportunity, it is growing, not the way it's growing right now, in a different manner, but a lot of folks from there moved over to Dubai as my parents did, and so that's how we ended up in Dubai. And it was a sheltered experience. That's what I would call it. I think growing up over here, I see like New York City kids on the subway when they're 10 years of age or 13 years of age. My mom was driving me to school. Thank you, mom. When I was 13 years of age. So it's a sheltered environment, a little bit protected, but still wonderful memories. That's where I started playing tennis, which is a huge part of my life.
Yeah.
Spent obviously a ton of time with family. Was able to see like grandparents every year because India is just about 2.5 hours away. And I don't know what the experience of people who now grow up in Dubai is like, if it's any different than what it was for us. But it was a sheltered, nice experience. We
I
went to
I
nice
always feel
schools.
very safe when I'm in the Emirates. Like
Yeah.
I don't know. I went to Chicago for midwinter this February, just before everything kicked off. Um, and when you're walking around an American city at night, you've just got that little thing in your mind going, was that a
Absolutely.
gunshot? Was it just a car? I don't know. Um,
Yeah.
whereas in Dubai, you could be walking around at 2 a.m. Because you've just, I don't know, you've been out late somewhere and you're walking back to wherever you're staying, and you're not bothered. You kind of have that. It feels much safer. I don't know if you have that same feeling. I love going to both places. Don't get me wrong. America's great, but if I'm in America, I'm thinking, all right, I need an Uber because I'm not walking.
Yeah. And that's the right decision to make.
I think especially in
uh,
like Chicago, I think it's pretty wild out there.
even New York City, actually, I was talking to some of my friends about this just yesterday over dinner, and some of them girls who would take the subway. I remember last year we'd finished dinner at say 11 p.m. or midnight, and she's like, "Yeah, I'm just gonna take the subway home. It should be perfectly fine." She was like, "I'm not taking, a subway
Nope, nope.
past 8 p.m." Yeah, exactly. And even I now feel extremely nervous, like walking. I did take the subway, but I was also, a very short distance from home, so I was like, it should be fine. But while I was walking from the subway station to my home, which is 7 minute walk or a 5 minute walk, I kept looking over my shoulder, pretending to be really casual about it, and like I'm not actually like looking about
Fake.
what's going on
You're like
around me.
fakely on the phone. Yeah.
Yeah, like yeah, exactly. Or like looking behind me casually, see, I'm just admiring New York City rather than actually like I'm like pretending to admire it when I'm actually like making sure I'm
It's
not being
a
followed or
real
something.
fake phone call. Oh, I can't believe you work for the police. It's shouting really loudly. That's so cool. Um,
Yeah, no, absolutely. But I mean, yeah, it is what it is. Dubai stuff, I do think it's safe. I would say that I think it's not as transparent as we would want it to be. But again, what city really
no, I
is?
mean,
Mm,
if you go to
I think,
London, for example, there's, if you go to central London, it's great. It's, lovely food, amazing. Whereas if you go into the suburbs, then, you've got a lot of poverty and a lot of crazy stuff going on, gangs, all that kind of stuff. And it's going to be the same. There's going to be a positive and a benefit to every city, right? Um, it's just that Dubai's negative doesn't see you get shot on the way home.
yeah, that's very true. What month of the year did you visit Dubai? And that's important.
Hmm. Yeah,
Did you visit Dubai in the summer or the winter? Winter.
yeah. It's hard to because the winter it's funny in Dubai because you don't get it's either like humid. Do when it's
Yeah.
like it's wet in the air and you walk outside and you're drenched already, or it's like really burning hot. And I don't know which way I prefer because there's like again positive and negatives to either.
That's fair. That's fair. I like visiting Dubai in November and December, January. The weather's 70 degrees Fahrenheit or 18 degrees Celsius, whatever you want to call it. Everyone just seems like they're in a happier mood during that time
Mm.
versus like during July or August, everyone's just annoyed. It's 50 degrees Celsius outside. No one wants to
I
hang
kind of
out.
like the heat though. Do you?
Yeah.
Yeah. I mean, my family, some of my family, more extended, are in Dubai, and then my grandparents and cousins are in Kuwait. So when you go to Kuwait, there's no cold sort of time. As soon as you walk out the door,
Yeah.
it's like your whole body's just been thrown in the oven. But I kind of like that feeling because okay, I can wash my face and I don't have to bother drying my hands. I'm just gonna walk outside, go 5 minutes. Oh, I'm dry. Oh, good.
That's a good way to look at
Yeah,
it.
and especially me and my cousin, we used to like chill out and we just talk and lie in the pool. And then if it gets a bit cold, we just stick your head up a bit. Oh, I'm warm again.
Yeah, that is fair. We actually, so I didn't even appreciate that Dubai was warm when I was growing up. That July and August or June are a super warm time because to us that was just
Hmm.
normal. It's only when I Canada and then we would visit Dubai, I'm like, oh, it's actually quite warm in this
Yeah.
country.
What else you don't realize is AC. Yeah,
Yeah,
we had
yeah,
only a few days in England this summer that just went, and it was that heat that was too hot to sleep in, where it's been
mhm,
baking hot all day, and the heat hasn't gone away in
yeah,
the nighttime. And you're lying there and you're
yeah.
thinking, it's too warm. You're throwing the blankets off, opening the window, and then it's hotter outside than it is inside. And you think, for 2 days of the year, AC would have been amazing. But there's a lot of benefits and blessings you don't really think about until it's not too late, until you kind of think, oh God, I could really do that now. Um, yeah, so what made you go to dental school? I think that's kind of always an interesting question. Did you have some alternative careers in mind? Because everyone seems to say, "Oh, maybe I was going to become an architect," but then somehow I ended up in medicine and dentistry.
Interesting.
It's a very common one.
Uh,
Really weird.
that's interesting. I didn't realize that. I wanted to do healthcare. That was that was laid out for me, or that was in my mind since maybe high school. That's when I started thinking about it already. And the extracurriculars that I got involved with during high school or even undergraduate school, it was all targeted towards eventually getting into a healthcare, some kind of healthcare
Yeah.
profession. And I hadn't made up my mind about what exactly is it that I wanted to do, but just as luck might have it, I think it was in my third year of undergrad, my bachelor's degree, when I just so happened to shadow a dentist. I really ended up liking it. It just seemed like super cool. I don't know. I still remember that shadowing experience and the feelings associated with it. It was just feelings of happiness, and I was like, I can see myself doing this, and that's basically how dental school happened. Very anticlimactic, not
There's
dramatic,
no.
just a very cool
I had
shadowing
braces when I
experience.
was a child, and then I had to become a
I
dentist.
thought, but that's not why I went to dental school.
Uh,
But I mean, it did involve a shadowing experience with a dentist. I guess he was a great guy because I enjoyed that time. I was like, I can see myself doing it. And yeah,
yeah,
that
it's
was really
similar to me actually because I had dentistry was not on my radar. It
cool.
just wasn't. I was thinking, oh, you know what would be cool? Neurosurgery. I want to be a
Oh,
brain surgeon. No, I not even because I knew anything about it. I was just like, a brain
that's
seems
just
cool, and cutting brains up seems cooler still. But then in the UK especially, you've got a very small chance of becoming a surgeon. It's very very difficult, and it takes up a lot of your time. It takes up a lot of your energy and stuff like that. And I'm very lazy, very
oh
very lazy.
no.
So
Yeah, people. Maybe you made it through dental school and you want to do endo now.
yeah, but no, but it's like you can do endo, but you can do endo 9 to 5. There's no night calls with endo. Don't worry about night. No one's gonna call you at 8 p.m. Go, I need you to come in. So yeah, I actually don't know why I chose dentistry in the end. Probably just the working hours, and it's kind of surgical. It's a
Yeah,
question I struggle with.
is it really or not? Yeah, that's fair. It depends on what your definition of surgery is. But yes.
You have a knife in your hand, you cut something, you sew something up. There's your
That's
root enclosures maybe.
true.
And then obviously you've then gone through dental school. What point do you think I just don't want to do like caries and perio, and you want to fix faces?
So I'm gonna say this because this happened recently. I actually so in our emergency clinic in at the hospital that I'm in, we do have patients who come in with my tooth is hurting and he probably just needs a filling. Doesn't necessarily need an extraction or something else. So I recently, just to help out, I did a filling on a patient. I've not done one in 4 or 5 years now, but I did do one and I actually enjoyed it. I was like, oh, I love the intricacy behind this. This is fun. But anyway, moving on
Was
from
it the
that.
novelty of actually doing a filling and not sticking plates
Was
in?
maybe it was different from what I had been doing for the last many years. So that's what made it more exciting.
Yeah.
But I enjoyed it. I didn't completely hate the experience. Um, but so I actually was at a hospital a couple of years ago in Center here in New York. Um, so it's a very busy hospital. Still continues to be a very busy hospital. And I was doing a general practice residency over there for a year just to gain more experience in residency. There was no thought about um, I want to do more specialization or that I don't like dentistry. There was nothing of that. But I took call over there, so we help out in the emergency department over there a few times in the month. And I took call. I took call on July 4th, which is a long weekend here. It was extremely busy.
Yeah.
We went to the emergency department at 7 p.m. That's when we got our first page, and we got out at 6 a.m. the next morning because that's how many patients were just coming in, like jaw fractures, facial infections, long lacerations from like box cutters and other things. And I left at 6 o'clock being like, that was so cool. That was an aha moment. It was like, that was amazing. I have not been this excited in 4 years. That was awesome.
That's fair enough. I remember
It,
we
it,
did one day, or I shadowed a surgery for one day, and it was stage 4 SCC. It was taking up most of the tongue, good chunk of the mandible, and they were doing a double neck dissection to get to the lymph. And then at the same time, you had the orthopedic surgeons, chopping up the legs so they could put some fibia or tibia or something back in the jaw. And then there was like seven anesthetists there, like on a rotation, and they're like, "Yeah, so we're going to be doing this for the next 36 hours." I was like, "Wow." I think we last me and the person we were shadowing from dental school, we lasted about 4 hours, and we're like, "So can we like, yeah, we're gonna go."
Oh, no.
He was like, "Oh, you can come back. We'll be here for another 22 hours." It's like, "Yeah, we'll see how we feel after lunch." We just went home and slept. I think it was like, "Oh, it's too much."
But yeah, that was like a big like, oh, I remember this. This is so exciting. I still didn't decide right away that I wanted to do. I wanted to pursue OMFS. I had just moved to the States. I was like just figuring out like living here and being here, so that took up a little bit of time. I also had friends who had already done surgical residencies, not necessarily just OMFS, but other residencies. So I knew what a surgical residency entailed. That if you don't want to struggle through it, if you want to do it well, if you want it to go well, you have to kind of be in this particular mindset. You have to be ready for it. And I just wasn't sure if I was 100% ready. So I took my time. But when I actually finally decided that I wanted to do this, and I used this word with someone I was talking to yesterday, I was obsessed with the idea of getting it.
Mm,
When I actually had to study for the exam that we write so that we can, apply, when I had to actually put my application in together, like on the way to work, I would have 20 minutes. I would make sure that I would take a cab to work so I could use those 20 minutes to fill out applications. Like I didn't want to like lose a single second of my time. Like the exam that we have to write, I studied for it maybe 15 hours a day. My parents would be like, you should get up, and I have Indian parents. They like are very supportive of studying and the concept of studying. They're like, no, you need to stop. This is unhealthy.
yeah,
Go do something else. I'm like, no, no, no. I need to study. This is like live or die kind of situation. That's how I made it out to be. I don't know if that's the correct way of going about doing things, but I was obsessed. I thought that I could not live without OMFS. And yeah, that's how I applied, and it worked out. I got in, so
yeah.
it was it was,
It's
it was
it's
worth
worth
it.
it in the end.
Session. I think so. I like what I do. I really do.
Yeah.
I I come back home happy.
Imagine telling your parents like I have that. Oh, maybe I want to do YouTube as a career. What do you mean? Can you make any money from YouTube? You just sit there and talk.
My parents were not. It's like, what? You can do that?
He's like that, yeah, but
um,
it's not a job. Um, yeah, I mean, it's one of those things, I think you're right. Once you get to that point where it's almost your obsession, you're just like everything you think is like I need to become, I need to get in, I need to get it. That's and otherwise, what am I going to do? I'm not interested in all these other things anymore. That's kind of when like you've taken the right pick, isn't it? And you kind of just have to go for it.
I hope so. I know some people in my life who would not agree, and it's like, I don't think you need to obsess about something. If it happens, it happens. It's good. It's meant to be. Like, friends have, I mean, everyone has different opinions, but for me, just the way it worked out, I don't think that everything in my life that I pursue, I tend to become super obsessed with them. Actually, like a small effort every day leads to a bigger outcome eventually. That's actually my general personality. But I think the way I treated all my first was like, I have this one shot, and that's it. So, yeah,
Yeah,
that was great.
I think you're probably in the right position. I can feel like hearing you talk about it. You've got the passion for, you know, everything that you're doing, and I think you'll probably be fine, and probably made the right decision. And that's important because you're gonna do it the rest of your life. So you have to have that. Otherwise, you're kind of just gonna be, I don't know, you won't be as fulfilled, right?
No, absolutely. I mean, I think you spend, a large part of your day, fortunately, unfortunately, at work. It's helpful if it's something that you enjoy.
Yeah.
It's definitely there. But I am grateful that whatever I'm doing, I'm not miserable in it, and I come home feeling happy. And even while I'm at work, I'm happy. So I am grateful for that.
Yeah, I think that's really important. What have you seen so far? within your time in the ER or the operating theater that you just gone, oh wow, or like what's been like the most interesting surgery or condition that you've seen? And does it integrate well, because we have something called oral medicine as well in the UK, which is, you know, your lesions, and then if something needs treatment, you know, surgical treatment, it goes to oral maxillofacial surgeons. Is that all in
Yeah.
one, or are you guys separate as in the UK?
So they do have an oral pathology training. Um, it's not that readily available in terms of training programs, but it is there. There's a couple in New York. Actually, one of my attendings, so supervising physicians, not only is he OMFS, he's also trained in oral
Okay.
pathology. So he did both. And so he, he's great at teaching us about pathology. And anytime we actually treat a pathology, he's great at, diving into it more deeply and being able to go over the histological slides with us really well, or going over like clinical signs and symptoms and things like that to look for. So definitely very helpful for training. But it is different. But we also learn pathology in OMFS, not in the kind of detail that maybe someone from oral medicine or oral path
Yeah.
would learn. But definitely do. It's on our exams. It's going to be on our boards where we have lectures about it and things like that. So we do learn it. And in terms of, I wouldn't call this the coolest thing I've seen, but probably the thing that's
Stuck with you.
the story stuck to me was an older lady, and this is not cool. This is actually sad. Older lady who shot herself in her face right through here. She completely shattered her entire face open. And that all of us co-residents were in the ED at that time, so we ended up getting paged first, although there's a lot of other teams who could have been paged before us.
So what happened? Did you walk in and the face was just everywhere?
Yeah. Yeah. She passed. She didn't make it. There was too much
Yeah.
damage. But that stuck out to me just as like a sad thing. And I think just like hearing stories like this or seeing stories like this and being in a position to help out with something like this and help a person who's in that situation, I think it's gratifying. It's good to know that that situation can exist. Or recently, so where my hospital is, there's patients with tons and tons of comorbidities, and one that I'm finding that tends to be more prevalent than a lot of them that I was not expecting is psych issues. So many of my patients come to the ED having broken a whole bunch of their bones because they hallucinated something, or they have suicidal ideations and they jumped off the building, or they hallucinated something that told them to jump off a building. So we have like a lot of patients like that. And the young guy actually came in last week. History of psych, not compliant with his medications, heard voices that told him that you need to walk up to the third floor of this building and jump. And so he did. It's probably 30 something. Such a nice man. Such a nice man. Just I ended up taking care of him for a lot of days, so I guess that's sticking out to me right now. But broke every part of his body, bunch of bones on his face. He's been back to the operating room so many times in this last week. So yeah, these are, I think it's the people stories that stick out to me. The story behind the people.
Yeah, I think that's, I think you almost forget it sometimes, right? Especially as maybe a dental student or someone who's trying to learn their trade, where you're still trying to get to grips with the technical. I need to learn how to do this properly. And actually, that's kind of stuck in my mind actually, because I watched a video not so long ago of Dr. Brett Gilbert, and he had a live patient in the chair. It's on YouTube. It's if you search up his thing, if there's anyone interested in watching it, he's got like people behind him just in the corridor, and they're watching on a live screen. So he's teaching as well as doing the endo, as well as reassuring the patient and going, "Oh yes, I think he was name. I can't remember the guy's name, but you can still see him having that connection with the patient." You go, "Well, actually, he's kind of distracted now because he's teaching still, and it's a live demo." But just imagine what he's like when it's just him, his nurse, and the patient in the room. He must be very, very in tune with what's going on. And I think that's a lot of healthcare, is really, really important, because you need to manage the person, because just say, for example, you do all these things, and then within general dentistry, if they just go back and eat a load of biscuits or cookies and have some more fizzy drinks, then they're back to square one. And if you haven't built up the relationship, then maybe you can't get them to change some of those habits.
I think I used to be like that a lot more, where I would get so caught up in what needs to be done that yes, I would forget the patient's story. But I have been noticing lately that I have been not only just focusing on what needs to be learned, but connecting with the patients a lot more recently, and I'm grateful for that because that's important. I'm also grateful that it's not to the point where it harms me. Like I'm able to feel for the patient, but also separate what I need to do for them.
Yeah, you're
So
not
keep
coming
those.
home and just like crying because it was so soul destroying or
I'm
anything
not.
like that.
I'll talk about it and share the
Hmm.
stories and do the best that I can for these patients, and from a surgical perspective and from a human
Yeah,
perspective. Uh, Even if that is like making sure that the patient's fed or whatever needs to be done for the patient. So I've noticed that recently more so. I've started to like know what patient stories are, remember them, feel for them, be there for them in every way possible. It's nice. It's nice to see
yeah,
that
yeah.
progression.
And maybe as we get older, we just have that capacity, and maybe I don't know. When you're younger, you've got other things on the mind, and you've got less mental space for it, maybe, and you're getting more and more competent day by day. So less of your active brain is going towards what am I doing. It can go towards the patient a bit as well.
Yeah, absolutely. I think a lot of the patients who, I'm sure you can speak to this, anyone who comes to even a dental clinic generally, they're not happy to be there. Like your parasite skills need to be so good because everyone will sit in your chair and be like, I'm upset that I have to be here. At least that's been my experience. Now add like that to like my face is broken. I have a huge laceration on my face. They're not any happier. So I think those you really learn to develop those skills.
Yeah, I think they've probably got more pressing concerns than when they turn up to the OR with, I don't know, the lip hanging down here. Uh, they're not gonna go, by the way, I hate dentists the first second they come in the door.
I practiced as a dentist as well uh, before I pursued OMFS, and patients were not happy to. I'm sure that's probably the same thing back in the UK. Patients are never happy to be there.
No, not
People
not even once. And if you do get someone like that, it's very strange. And I'm
try
thinking, what's
to,
wrong with you? What's
yeah,
your
exactly.
angle?
Yeah, like I pointed out to the patient, I'm like, you're one of my only patients who's happy to be here. Nobody else wants to be here.
Yeah,
I'll say in no matter, but it is true.
it's interesting you say about the difference. You're seeing a lot of patients with mental health issues, maybe because I was reading there's like 1 in 4. I can't remember whether it's adults or adult women in the States are on like some form of antipsychotic, antidepressant. Uh, why do you think that is?
I have no idea actually. I really don't know. I've just noticed that more than any other. So we tend to rotate through a lot of different hospitals, and this hospital, especially that I'm rotating at right now, I've noticed that there's a lot of like we'll have patients who we've had a couple patients who've actually come in concerned of some kind of facial fracture. We ended up fixing it for them, and then as their hospital stay progressed, we learned that they had other psych issues going on, whether someone was bipolar and they were not on their medications, or some other issues as well. That seems to have come up quite a bit. I've just noticed that. I don't know why. Um, I don't know if it's becoming more, if it is more prevalent in the hospital than I'm at because patients are not compliant with their medications. Maybe the numbers are the same, in Manhattan as they are in other boroughs, but maybe people are just, they are a bit more compliant with their medications, they have more access to care than maybe people of other,
Areas, yeah.
boroughs. Yeah, so maybe that's what it is, and that's why it's coming up. That's why we're learning about this. We're seeing this a bit more where I am. I'm not sure if that's the reason, but definitely very prevalent. We've had multiple patients who we've treated, and then they ended up in the psych ward of our hospital
Yeah, that's very
for like
worrying because to have I think it was 1 in 4. Don't quote me on that.
yeah,
I may be completely wrong. There's something obviously going on. That something is not quite right within. It's probably beyond dental and Max Fax sort of a topic, actually, isn't it? It's more like societal. I don't know. We should be like sociologists or something to get into why that is.
for sure. But it definitely, I've noticed it quite a bit with our patients.
It would be interesting to see whether you kind of see any, as time goes on, whether there's any similar themes when you speak to the patients about their lives that you find, okay, well, they always bring up a certain thing. I don't know. Maybe it's money matters. If there's money worries, and that some people maybe just aren't as well equipped, to deal with that kind of stress.
No,
Who
absolutely.
knows?
Like, yeah, you're right. Don't have the money to get therapy or the help or access to healthcare. Period. Definitely all
Mm,
abilities for sure.
very strange. Um, Moving away from dentistry because we all spend lots and lots of time talking about dentistry. I've been asking a question to my guests, and um, it's if you had your own podcast, who is your three? Imagine you have your first three guests are the three people that would be like the perfect people for you to speak to. Who would they be?
I love and hate these questions. So because of my knowledge of history, which is rooted in like knowing Indian history more than anything else, because I was raised in Dubai and they taught us about the history of India and countries in that area more so than anyone else. I have two people in mind. I don't have a third for you right now. It would probably actually I do have a third, um, and that's based on having lived here in the states now. Mahatma Gandhi, Mother Teresa, and Obama. Those are the three people that I would want to speak to, learn life pearls from, just ask them, what advice do they have for me, learn about their life even more and more detailed than we've been taught about it. That's who I
It's
would.
interesting because you've gone
I
for
would
like
want.
more inspirational figures. You've not gone with like an anti-hero, like a more infamous kind of person. So you're very much going
Yeah,
for I need more life advice. Like just tell me how to live my life.
yeah. So some of the books that I actually read when I read outside of Omar Fast, which I've been doing more so lately than I should, it's always like self-development books.
What have you read
That's
recently that's been good?
that's
Because I've been reading a few bits and pieces. At the moment, I'm reading football tactics books, so it's probably very boring to you. Um,
I wouldn't
yeah, but
understand
what
it.
what stuff have you been
Um,
reading?
um, so one of my friends recommended a book to me called Bargaining for Advantage. It's basically about negotiations in your daily life or at work, personal life, whatever you want to call it. That's a book that I've been reading, and it talks about some of the points that stuck out to me were how to develop relationships and how those are so important to be able to negotiate effectively. Possibly, that's one of the things. We talked about leverage and how having clout is so important. And these seem very obvious, definitely. After I read them, I'm like, yeah, duh, of course. But it doesn't always just come to mind or come naturally, on a daily basis. So they were nice reminders. Really enjoyed that book. I'm still reading it though, so I have some ways to go. I was super inspired when I read the 5 a.m. Uh, book, 5 a.m. Club, 5 a.m. Morning Club. I'm forgetting the name of the book. It's by Robin Sharma,
Right.
and it's basically he gives you like or recommends three things that you should do every day as soon as you wake up. And he said that that can lead to a very successful and fruitful and fulfilling life. That was one of the other books that I read, and I read a few others, and I have to keep revisiting them all the time because I do forget them. How to Win Friends and Influence People. That's another
Dale
book that
Carnegie.
I.
Yeah, I was just looking for my Kindle to tell you what I've actually read previously, but I can't see where it is right now. But yeah, that's a really good one. Um, oh, and there's a few by Mark Manson which are quite good.
Oh really? Okay, I'll look into
Yeah,
that.
there's
I books like that. I don't end up reading anything else nowadays, at least.
where have I put my Kindle? I don't know where it's gone. I did try and read some of these like older school ones, like what's it, Marcus Aurelius. The translation I got was horrific. I couldn't get through it. Could
Oh
not get
really?
through it. Yeah, and because I couldn't get through it, I didn't take anything away from it. So maybe I need to find like I don't know, like an audiobook of it or something, or like an abridged version where it's like explaining it all. Meditations, it's called, I think.
what do people usually pick? Like, which people do people want to interview? What's been your like top view?
So we've had sports people quite a few times, like their favorite sports
Oh,
heroes, because yeah, and we've had that. We've had did someone say they wanted to speak to Hitler just to see what was wrong with him?
he
Did
probably would say nothing is wrong
I
with
know,
me.
but imagine you sit there. I can't remember if someone said that or that was something that I took that idea. I took that idea of a question from another podcast. I can't remember whether that came from someone's answer on another podcast. I can't quite remember. But you could sit there and you just like you could just probe at him, you know, through the whole couple of hours and be like trying to work out who this guy is and like what
I guess I'd love to hear his answers.
it
That
would
would
be
be cool. I
terrifying.
can see that. Yeah, yeah, sure.
Yeah.
Yeah, as long as you feel protected and
I know. Yeah.
yeah.
I mean, maybe he
But
could just be some sort of weird ghost. Like I don't know.
that would be cool to like really ask him a lot of questions and then come to your own conclusion about
Mm.
like what went what went on there.
Yeah. I mean, a lot of people say Churchill. Um,
Oh
I
yes,
don't like him though.
yeah,
I mean, you're. I mean, I'm half Indian. You're Indian as well, so you probably maybe heard some of the things that he did within India, which were
yeah,
not very nice, let's say.
yeah.
So it'd be interesting because all of these guys were kind of like. It's like imagine if someone else had won the war, then you have a completely different writing of history, and then you can, you know, they'd probably say, I don't know, oh yeah, Churchill was a terrible person. He did all these things to the Indian people, and you know, didn't they do something in like the Boer War as well? Some craziness. So it would have been a completely like flipped on its script. I don't know.
Yeah. That is very true. Where else are you from? You said half Indian. Like
Well,
where,
probably. I mean, let's be honest. It's all Indian because it's Indian Pakistan. It's the same thing. Let's be honest. Like, just because these guys drew a line in the map doesn't change where you're from, right? So, yeah. But then we moved out quite soon after. So some of my family's in Kuwait, um, and then a lot of the families in the UK now. So we're kind of spread over all over the place. And then lots of guys in UAE, some in Canada, some in like Michigan, LA, North Carolina, just we're everywhere now. So yeah, we're pretty
I'm actually curious to know how dentistry works in the UK. Like, what is the setup like?
uh pretty weird. I think if anyone that every time that I describe it to someone who's working in like a fee per item sort of way. So with you guys, you have like a insurance based system, don't you?
Yeah, we
So
do.
if you do 5 fillings on a patient, you bill 5 fillings and you get 5 times one fillings price. In the UK, it's semi-funded by the patient and
Oh,
kind of funded by the government. The government wants to pay as little as possible, obviously because it's their money and they're trying to make it go as far as they can and whatever. And they have political ideas about saying, oh yes, we had more people than ever see a dentist this year. Okay, you know, all that kind of thing. So if someone comes into
no.
me, let's say I go to the dentist and you go to the dentist in the UK, you go in, you need one filling. So you would pay about 60 pounds, and that's your no
Perfect.
for the whole thing, and that's your
Okay.
contribution. I need 8 fillings because I've been eating like crap and I don't clean nothing like that. I also just pay 60 pounds. Okay,
Wow.
the government then gives the dentist £30 to the guy who saw you, and also only £30 to the guy who saw me.
Oh wow.
Can you see where this is like a really bad idea?
Wow. Do you feel that like patients don't get treated to the degree that they should then because of this?
So what happens is you start a job if you're working NHS, and this is you could decide I'm not going to do any of this craziness, and I'm just going to work privately. And then it's like the patient comes pays for one filling if they need one filling, pays for 2 fillings if they need 2 fillings, and then that's the fair and equitable way of doing it. Um,
Ooh, it's tend to be private though. Like how do they? Is it does the government not cover everybody, or does the patient elect to be private? Like how does that?
well, because of that situation where if you come in, you get the same amount for if a guy like me comes in. I don't actually need fillings, so just by the way, guys, I don't need fillings. I'm just gonna say that. But it means that the dentist has to work super super fast to make a profit and to actually have a living and to meet the target. So they give you a target as well. You have to do a certain amount of treatment, otherwise you have to pay the government back for failing
Okay.
to fulfill the contract. So it's crazy. So what happens is it's very rushed. Let's be honest. If
No,
you're having to do it at such a pace, the patient feels rushed as well. You feel rushed, and then corners get cut, the standard goes down, um, and patients feel that. So if you go to like a nice clinic, and when they come in the door, they give you a cup of tea, and then someone's there doing your nails or something, all that kind of like high end sort of thing.
that sounds like a dental spa.
Yeah.
And then you said nails.
That's the feeling. It's like when you go for a massage or something. Like you feel they sit you down in a nice chair in the waiting room, and there's a beautiful coffee machine, and you're drinking a coffee or something, and then they call you in, and you get half an hour with the dentist just to see how they're like, and then do a nice slow examination, and they pay for the service essentially on the private side of things as much as your expertise. So that's kind of how it works in the UK. I don't know if I've explained that very well, but
That's very interesting. So a person could need like an endo, a crown, on a bunch of
mm,
teeth, and another person need like one filling, but you're compensated the same way.
yeah, the crown thing's crazy because if a patient needs 2 crowns, you make a loss.
Yeah,
So you're just like, oh, I'd rather not see that kind of patient. So what happens is you fill up a list. So you can see maybe 400 or 500 patients in a year, and that's your list of patients that you look after. So what you want to do is you want to never have new people on the list, or if you get new people on the list, you want them to be people who are likely to not need much treatment. So then you just keep on seeing those same guys again and again, and you don't have to do too much. Um, so it's a very strange situation, and I think 1 in 2 people don't see a dentist in the UK.
oh
Mm.
wow.
So yeah, I mean, it's a crazy system. Crazy system.
Oh, that's so interesting. I didn't know that. I mean, things are really rushed over here too. The reason being that so a lot of my, just attendings or supervising physicians or dentists, whatever, they keep saying that the way insurance is set up in New York specifically has changed a lot in the last like 7 or 8 years. So compensation 7 or 8 years ago were fair and reasonable to the point that dentists didn't feel the need to rush things and they could take their time with their patients and do their due diligence. But as like insurance companies pay lesser and lesser, unfortunately, again, to make a profit, to be able to pay your employees, to be able to pay your rent for the office space that you own or
Yeah,
rent, you have
materials,
to.
CE.
It's so unfortunate and suffer. That's like that bothers me about the private sector a lot. There's so many different issues associated with just working at a hospital too, but the private sector of just being in private practice and taking insurances and seeing patients who have insurances, um, that bothers me. That like you're technically not possibly treating somebody the way they should be treated.
Yeah, I think it's one of these things, and I think with insurance, it's different because an insurance is a private company, right? And you pay into it, so they're always going to try and
Yeah,
shortchange the patient because they want to get away with paying as little out as possible because there's um I was watching someone from the States, and he's advocating for a different system of healthcare and stuff like that. I said, well, how can you have private insurance companies where the CEO is taking $15 million a year in bonuses? Because that $15 million a year isn't coming from like investment, it's coming from like the money that should have been spent on people. So
yeah.
yeah, it's
No,
it's it's an interesting situation.
as more and more time goes along, the way things are set up and the way they're set up for people, that it bothers me.
Yeah. One of the last couple of questions to ask you, I think we'll probably just start wrapping up here. Now, we've been going for about an hour. I know you've got some things to do. So, where do you think your future is gonna lie? Do you think you're gonna end up in, is it hospital based, or is this something such as, for example, like a private sort of jobs for or Max Fax in the States? Because I don't know much about how it's set up.
So we do have two routes that we can go. We can stay in something that we call academics. That means that you stay affiliated with a hospital. You might be associated with, not might be, but you're likely associated with a residency program. That means that you're teaching residents. The hospital pays you. You maybe do research for that institution if you want to, and you don't get paid much because academic programs don't pay their their providers that much. Or yes, you can go into private practice. You see patients in a private clinic. You do a lot of dental alveolar, maybe some cosmetics, so like sinus lifts, dental implants, all of these things. Patients pay for them out of their own pocket, and definitely can be very lucrative.
Mm.
I actually had a very long conversation with one of my attendings because finally 3 months later I'm a little bit more relaxed now until the next challenge comes along. But I was talking to somebody about what their recommendations were in terms of what I should start to pursue, and I was thinking that I would want to do a little bit of both because I like research. I like teaching. When you're affiliated with a hospital, you get to do good operating room cases. When you're in private practice, it's mostly just clinic chairside procedures that you're doing, which is great too. It's just to each their own, what they consider really wonderful.
Yeah.
So I had this idea that I would try to do both. He was of the opinion that you want to try to pursue one or the other. Like if you really want to advance in one field, you have to just be in that one field. Like you should just either do academics or either do private practice. What I know, like research, I like teaching, I want to do good cases. That's my knowledge so far, but I haven't decided what I want to pursue eventually. I'm not clear cut on that, but it's a lot of things in my life. I tend to make more last minute decisions, or I figure things out right when they need to be figured out versus like knowing super in advance. So I'm sure it'll come to me. I haven't made up my mind. I'll get to stay in academics, and yeah, that would be ideal. There are some disadvantages to it, and I'll find a way to deal with those disadvantages, and that would be my ideal world.
Yeah, and
It'd be nice to have that kind of balance of doing a bit of this, a bit of that, so you have a bit more variety, right?
Absolutely, that's a lot of people do that. So many of our attendings, they do private practice a couple of days, they come to the hospital a few other days, and they love what they do. He just had an interesting take on the whole thing. He's like, I don't think that you can advance as much as you want to in each of the fields unless you're just in one. That was his opinion, but that's one person's opinion. I'm planning to obviously talk to more people and look into it a little bit more. I think you start to look into these things when you're in your third year or so more. So I'm still in my second year, so it's a bit early, but I'm starting to think about it for sure.
Yeah, sure. And finally, is there anything that you would tell your kind of 18-year-old self, or pre undergrad self or whatever, if you had some advice for someone younger?
I would tell them to work hard while you're in whatever you want to call it. Meet as many people as you can, enjoy yourself. As you get older, and 18-year-old Natasha always wanted to get older. She's like, oh, it's so cool. You're going to have so much freedom and you can do whatever you want when you're older. I don't think that's true. I'm more tied down by responsibilities. And I mean, I love it, but I'm more tied down now than I was when I was 18. So I would tell them that, enjoy this time while you have it. There's a lot you can do with your life and take advantage of it.
Yeah, for sure. So yeah, I think we'll probably just call it there. I know you've got a lot to get on with today. Thank you for coming on. Thank you to the guys who've been watching. I know we've had quite a few of you watching, not so many comments. So I think it was just really interesting hearing what Natasha had to say. So thank you to everyone who's been here. If you make sure to like the video if you're watching, subscribe if you're new, leave a comment if you've got any questions, and I'll pass them on to Natasha in due time. But yeah, thank you for coming on.
Thank you very much for having me here. I hope you have a good rest of your night.
Yeah, thank you. It's getting 8 p.m. I've got to go to the gym yet, and then I can finish up. So yeah.
Okay.
Yeah, that's it, guys. If you've been enjoying the stuff that we're doing on Hot Pot Podcast and Dents of Insta, check out the link down below if you want to support the channel. It's called the Patreon group. We've got a whole host of really interesting bits and pieces there. We've got a Discord channel, which is a big chat room with some dentists and like a bit of a support group. We've also got one-on-one Instagram tutorials if you want to know how to grow your page and stuff like that. If you want to get a few more patients in the door or just get a few more followers, I can help you out with that. So check that out. It also really helps me out improve the quality of the channel. And we've got some nice bits of kit as a result of the awesome guys in the Patreon group. So little shout out or thing to plug from me there. Make sure to head over to the link which I'm going to be putting in the bio very soon, which you can click on to follow Natasha as well. Is there anywhere else other than Instagram we can find you?
No, not yet. I'm hoping to change that, but not yet.
Awesome. So that's it, guys. Big thank you to Natasha, and see you next time.